Hi, everyone.
Good evening.
Hi.
I almost just said good morning.
Is there a joke somewhere there?
I guess it's going to be short since there was no governor and no.
Well, Dr. Scott gave a press conference.
Oh, okay. All right.
Actually, I have something to say about it.
Okay. Thank you.
Sure.
I'm not sure if Lynn's going to be joining us.
Yeah, I talked to her earlier today. I'm not so sure she's going to make it.
Yeah.
Angela's running late.
Great.
I have 429.
Yeah, I know. Me too. At 4:30, we're going to start promptly, only because there's a lot of things going on for different people.
Yep. Just give me the cue.
Good afternoon. Okay. Whoop.
You're on, Gene.
Okay. Okay. Good afternoon. This is our COVID meeting. We will have the manager present. I understand that it was just Dr. Scott this afternoon. So, Joe, if you would like to get started, please.
Sure. Just generally, by the way, on Thursdays, we have a League of Cities and Towns COVID discussion, a myriad of issues, and then it's followed up by the press conference that was conducted today by Dr. Scott from the Department of Health. And then we usually have a follow-up with the governor's office, just kind of a debriefing from that press conference. But in any event, one of the noted things from the press conference today was that, and from the RIDA website on the numbers, was that the positivity rate from yesterday was 3.5%. That's according to Dr. Scott. The numbers are trending in a good direction. She was happy with that at the press conference. There are 379 people that are currently hospitalized. That's around what it was last week. We are noted on the RIDA website as having 105 new cases, down from 143 the week before. If you recall, I think I gave you the number of 133, but they must have added some cases between last week and now. But suffice to say, 105 new cases for a 4.5% positivity rate. Middletown is at 4.5%, and Portsmouth's at 8.2% in terms of their weekly positivity rate. I looked at most of the numbers in the communities across the state of Rhode Island, and while I'm not going to say there's anything, it's a significant decline. It looks like most communities, in terms of their numbers, are coming down. And so maybe we're beyond the Christmas problem, as it were, and into better territory. I don't know whether you're aware of, but I want to mention anyways. There's some new testing sites that are popping up. The Knights of Columbus in Middletown on 7 Valley Road is opening as a test site. It's open 7 days a week, from 9 a.m. to 5 p.m. Asymptomatic only. It's a walkthrough, and it's performing the Binex, a rapid test. You have to make an appointment on the Rhode Island portal to get the test there. So, but that's good news. It's a state-run facility. We still have the Stop and Shop facility that you're all familiar with, but there's also in Newport a new walk-in site that just popped up this morning, and that's at 21 Brown and Howard Wharf. Tuesday through Saturdays, the time is 9 a.m. to 5 p.m. Asymptomatic only walk-in, and it's performing the Binax now rapid test. The Edward King House, again, this is their second week, I think, in which they're performing tests. They're scheduled doing tests on Thursday and Friday. The times are noon to 4 p.m. And the results, obviously, with the Binax are available the same day. I know we referenced the Baptist Church, but I have it as the Turning Corner, 50 Dr. Marcus Wheatland Boulevard, days Saturday only, times 11 a.m. to 3 p.m. And again, it's the Binax rapid test. I'm going to move on to the very limited information that I have on vaccines, unless you have some questions.
I do. In regard to the testing, the Binax test, if somebody that goes to one of the places and gets tested and gets called and says positive, what happens then?
Well, they're positive. They're going to go into the state database and they're going to hear from the contact tracers.
Okay.
No different than any other positive test.
I guess the question is, because there's been a question on that rapid test about the accuracy, will they then have to go for the more in-depth test?
No, I think they're just going to have to listen to the contact tracers, and I'm not aware of. I know you brought it up before, the accuracy of it. I'm not aware of any questions on the accuracy of the Binax. I mean, maybe I'm missing the literature on it, but
okay.
If, you'll just Rhode Department of Health will take it from there. Let's put it that way, and they'll advise you what to do. It's not up to your whim and whimsy how to proceed. They're gonna coach you through it, like they coached everyone else through it. On the vaccine front,
Joe, I actually had a question before you move on to vaccines.
Yeah, for sure.
You said that accuracy rate, the positivity rate, is that based out of the number of tests given?
That's how you can look, Jamie, as things have evolved, you can look at these numbers and honestly, there's so much data out there. You can you can construe the data, in different ways. And I haven't found a lot of consistency, like yesterday, and I was going to raise this. I wasn't going to raise it, but I read in last night's Daily News, which I think is the printed version today. My numbers don't necessarily, my positivity numbers and Rido's positivity numbers match up with their positivity number, but the number of cases doesn't match up. They had a higher case count than what Rido was reporting for last week. The positivity rate that is iterated on the face sheet of the Rido data page is simply taking the number of positive tests yesterday, if you will, divided by the number of tests given yesterday. So, 20,000 tests yesterday, and I forget what the number that was iterated, 966 or something like that, equals, just divide it. And so they would say they're at a 3.5% positivity rate. The way I'm looking at it is it's reflective of one of the other data charts, is simply taking that weekly number of cases as reported by Rido and dividing it by the number of tests in that given week to equal 4.5, the 7-day average, if you will, to equal the 4.5% positivity rate for that week. And I think that's the better way I've concluded that that's the better way to look at it, because it gives you that snapshot in time. So, to look at, and then you can also go on, and all the information is helpful, but you can also go to the geography, I think it's the geography chart on the RIDO website, which tells you the overall positivity rate during the whole period of time, from when the pandemic began versus the number of cases, number of tests versus number of cases we've had during the whole period of time, which has us at, I think, 7% positivity rate based upon that calculation, which still puts Newport, by the way, in the bottom rung, on the bottom rung. I think there's only 2 other communities that are lower than us. So but I think the more accurate way to look at it is looking at it on the positivity rate for the week, because that's what you want to know. How are things? How are we trending? When I talk with you, how are we trending in the last few days? So that's what when I say 4.5%, that's what I'm reflecting on.
Okay, thank you, Joe.
Thank you.
Yeah. The vaccines, they're still in phase 1. They're towards the end of phase 1. And next month, beginning of next month, we've been told that the over 75 group will start to get their vaccines through various clinics, and they're still working out the details. And then in phase 2, they'll knock off 10 years, and the age 65 and older group will start getting in phase 2. But again, it's an issue of nothing has changed in the supply chain dramatically. State is still getting their 14,000 doses a week. I think I don't have the figures in front of me. I meant to bring them, but the number of doses, I think, is around the 60,000 range. So it's still an issue of supply, and hopefully things are going to change in terms of that, because the systems are in place. The administrative systems are in place. We're ready from a local municipality to the extent that we will be in the process as a whole. We're ready to roll. I'm meeting with our team tomorrow to go over kind of the logistics of it. So we're in standby mode in terms of operationalizing any of the facilities that we think would be good sites. Right now, things are taking place through the CVS's and Walgreens, I believe it is going to the congregate care facilities and vaccinating people. And this week, there's a list of who is getting vaccinated this week, and it's still mostly, I won't get into the details unless you really want to hear it, but it's still the healthcare providers, hospital employees, and mass vaccination volunteers and staff, medical staffs, and nursing home staff and residents. So they're still working through those processes. And then as I said, phase 2, has the 75 and older set, and they're still working out, how individuals like that would register it, how do they contact them, how do they make sure they're getting the message to all of them, and how are they getting the shots in the arm, if you will. And I think some new information, probably the vaccine subcommittee is meeting tomorrow morning, and I think they're going to spit out some information, the same information that will be provided to the executive committee, and then they'll make the decisions on the slow crawl ahead, as it were. So it's something that's evolving every day. That's the interesting thing about this. There's new information every day, and it changes slightly. So I might, if I have that information tomorrow, it's public information, I'll provide it to all of you.
Thank you.
And then the last topic I wanted to mention to you, I found the press conference interesting today for really one noted reason. It's interesting otherwise, but really one noted reason is that talked about basketball a little bit, and Newport's name came up, and because one of the reporters, and I don't know who it was, they were talking about this thing, and Dr. Scott did a nice job distinction between boxing and basketball, you know, and why would you exclude boxing and wrestling and then allow indoor basketball to occur in a controlled setting? And then someone brought up, well, what about basketball and what about the place like Newport that doesn't have the hoops up? What do you say to them? And I'm paraphrasing, of course. And Dr. Scott said, oh, we will work with those communities, noting that outdoor exercise is great, you know, and she made some distinctions about basketball that I don't necessarily agree with, but I immediately dashed off a note to the Department of Health asking them, I said, Dr. Scott, just literally 20 seconds ago, our contact up at Department of Health just made this comment. What's up with this comment? And I'd like to know a little bit more. Our contact responded, and he has sent it over to DEM because they also have some input in these things. So we're trending towards this issue. I know what the answer to the issue is, but I want to hear it from them, and I want to hear how they wish to help. Because I know that's an issue that many of you have raised with me over these months, and quite frankly, I have felt awful about the issue in terms of not providing that recreational amenity, but we have stuck with the appropriate guidelines and have based our opinion on the data and the science that comes out of RIDO. So I'm going to be interested. I'll probably provide you an update on that in writing before the end of the weekend. But Newport was singled out. Might be some other communities, but the word Newport was used, and of course my ears perked up. And I know some of you have raised this issue numerous times with me over the course of the pandemic. So stay tuned.
Okay, is there any other information, Joe?
No, that's all I have today, Jean.
Okay. Are there any other questions from the council?
I do just want to say thank you, Joe, for bringing up the basketball situation. I know that's been a question for many months now, so I'm glad that maybe we'll have something going on there.
Okay.
Something, yeah. I think I'll just make one note. What prompted this? I think the question was the recent order that came out from the governor's office, supplemental order on sports. But you know, I can certainly make the distinction as to what they're doing in the order, and that is a controlled situation, indoor practices, indoor scrimmages, indoor games that are in a controlled environment, rather than your general pickup games outside. But the interesting thing about the order is I don't necessarily, at least the way I used to play, I know Chris Bean used to play, we don't see much difference between wrestling and basketball. They're both obviously close contact sports. So, and I will give a lot of credit to Dr. Scott and her dealing with that question today at the press conference. It's a tough one.
Yeah. Okay, thank you very much. I think this concludes our meeting. Thank you.
Thank you.
Okay, thank you very much for your time.